Good day, everyone. Welcome to Seco Direct, your premier podcast for all health-related topics. I'm your host, Dr. Tiwa, and today we're talking about a pivotal topic when it comes to people dealing with chronic kidney disease, and that is nutrition. For someone that you know, or if you know someone that is managing chronic kidney disease, this episode will furnish you with comprehensive ways to tailor your diet, which foods should you be vigilant of, how to maintain optimal health. Now, remember, seek a guidance from a dietitian for personalized advice. That is the most important part. But today, we're going to give you a breakdown of foods that are very important for you if you're managing chronic kidney disease. Let's start. So how are kidneys involved in nutrition? So the kidneys play a pivotal role in regulating the influx and efflux of substances in the body. So they purify the blood by eliminating waste and surplus fluids. How do they do that? Now, they aid in maintaining an equilibrium in essential minerals such as potassium, phosphorus, calcium. But if the kidneys are compromised, for instance, in the case of chronic kidney diseases, all these substances that have been in equilibrium now become accumulated in the body. Substances like sodium, potassium, and phosphorus. And when they accumulate to hazardous levels, it causes issues for your body, making your body retain fluid that can overwhelm it in general. Kidney disease is categorized into two forms: acute kidney disease, which manifests itself suddenly, often due to injury or infection, and chronic kidney disease, which progresses gradually over time, and if not properly managed, would progress to needing dialysis or a kidney transplant. Common causes for chronic kidney disease are uncontrolled hypertension, uncontrolled diabetes, genetic abnormalities, or autoimmune conditions like Goodpasture syndrome, for instance. Now, chronic kidney disease is typically stratified into 5 stages, and these 5 stages are based on the glomerular filtration rate. Once the GFR, that's glomerular filtration rate, GFR, once the GFR falls below 90, then the kidneys are deemed to be impaired. Now, this will underscore the significance of maintaining a wholesome diet when you have or you are managing chronic kidney disease. So when it comes to eating well with chronic kidney disease, a well-rounded diet plays a pivotal role in managing this condition. Because when it speaks to people that are managing chronic kidney disease, we always fear for 2 classes of people. First, the people that eat particularly rich foods in sodium, chloride, and protein, which can impose additional strain on the kidneys, and people that are confused on the amount of food or the type of food they should be taking, leading them to not eat enough, inadequate food consumption. A lot of things that we eat are usually vital nutrients that are good for our body, but it is always necessary for us to know the portions or the amount that we need to take that will not lead to strain on the kidneys. Everything like fats, carbohydrates, and proteins that furnish energy, sodium chloride, which influences blood pressure and fluid equilibrium, potassium and phosphorus, which help mandate regulation when they are mass in your blood, and calcium, which is good for your bone health, are all great for the body. But we need to understand and we need to get to know how we need to eat these nutrients so they stay as vital nutrients rather than leading to harmful substances for our kidneys. So for a lot of well-meaning chronic kidney disease patients that are very particular about what they eat and how they eat, they usually are presented with a challenge, and that is food labels, because numerous packaged foods always cover up concealed minerals that they have in their product, like phosphorus or potassium. Also, serving sizes can be deceptive because in each of these packages, they might say, oh, we just have minimum amount of so and so in our product, even though the serving size is actually more than what is stated. So for chronic kidney disease patients, they need to be aware and vigilant of the quality of each nutrient that they ingest into their body. Now, here's a brief guideline for the daily caloric intake that is required for each person. For fat, Below 30% of your daily calories and under 10% of saturated fat is required. For protein, approximately 10%, although this would vary depending on what stage you are in terms of chronic kidney disease. For carbohydrates, 50 to 60%, although adjustments are warranted if you have diabetes. For an individual weighing at least 70 kg, 70 kilogram, caloric intake should always range between 2,100 to 2,450 kilocalories per day. So when it comes to calorie counting, you probably need a device to count your calories. That is why you need to be vigilant with any products that you are buying from maybe the supermarket in terms of how they list the calories that are there or how they divide the calories that are stated on the package, so that you know where you are at with each thing that you consume. Modifications on this amount that is required per day may be necessary if you have a weight pattern, maybe if you are tilting more to obese or if you are underweight. Now, what is the link between obesity, your heart, and chronic kidney disease? Now, obesity and substandard nutrition can cause more strain on your kidneys and also cause cardiovascular issues. Diets that are rich in fats and sugars usually increase the risk of heart disease or chronic kidney disease progression. So to safeguard your kidneys and your heart, you need to be careful with fried foods. Instead, opt for grilled or baked or steamed or roasted dishes. It's not every meal that you need to throw on a pan and put hot oil to cook. There are also things like air fryers that can help out to manage this condition or manage your need to fry meals. Trim fat from your meat and discard any skin prior to eating them. Refrain from using butter in cooking. Utilize healthy oils like olive oil, for instance. Restrict saturated fats and increase vegetables and fruit consumption. Even though we say increase your vegetable and fruit consumption, you also have to be careful because some fruits are high in potassium. Now, we have to also go on to how we manage our sodium chloride and potassium intake. So when it comes to managing sodium chloride, which is very important because sodium chloride is the most abundant in table salt, for instance. And table salt has been known to increase blood pressure and also cause for water retention in your body, leading to a condition called edema. So when it's edema, you touch your body, you press into your body, and you feel like an indentation on your skin or on your legs, for instance. Now, if you feel that indentation and that doesn't come out to your straight skin after at least 10 seconds, then that is when you have edema, and it shows that your kidneys are being overwhelmed and they are not able to retain water appropriately. The general recommendation for chronic kidney disease patients to curtail their sodium chloride intake is 2,000 milligrams per day. That is 5 grams of salt. Even some experts have said even to reduce it even further to at least 1,500 milligrams per day. Now, what are the strategies that you can come or take upon to reduce your sodium chloride intake? 1. Abstain from processed and canned foods. Stay clear of instant noodles and salty snacks because they are very rich in monosodium glutamate and olives. That is the base of a lot of salt. Prepare meals at home without salt. You can season your dishes with minimal spices or salt adjacent replacements like vinegar, lemon juice, or pepper. Embrace what is called a DASH diet. When we say DASH diet, we mean dietary approaches to stop hypertension, which is a flexible and balanced eating regimen that leads to the cultivation of a healthy dietary pattern for your own life. Avoid salt substitutes containing potassium. So these are the strategies that you can take upon to reduce your sodium chloride intake. You can also monitor your sodium levels by collecting a 24-hour urine sample, which you can give to your healthcare provider to analyze. Moving on to potassium and phosphorus. How do we balance the need to eat potassium rich meals or the need for phosphorus rich meals to control the amount of potassium and phosphorus that we eat on a daily basis, because potassium in itself, it's very important for cardiac muscle function. Yet if it should accumulate when your kidneys are not able to filter harmful substances from your blood, they can cause problems for you. So regulating your potassium intake is very important. Certain medications like ACE inhibitors. ACE inhibitors, the full name for ACE inhibitors is angiotensin converting enzyme inhibitors, e.g., for example, lisinopril. We also have angiotensin receptor blockers. They are called ARBs. For example, losartan. We also have potassium sparing diuretics, e.g., example, spironolactone. And we also have NSAIDs, which are non-steroidal anti-inflammatory drugs. These drugs can elevate potassium levels, though, so you need to consult your healthcare provider prior to making changes to these medications, especially if these medications are helping you to manage other conditions. Meanwhile, medications that help lower potassium include furosemide, which is a diuretic. Now, what are high potassium foods that you need to look out for? We have bananas, papaya, yogurt, and raisin. What are low potassium foods that you can inculcate into your own diet? They are apples, berries, lettuce, cauliflower, cucumber. Boiling vegetables can also help reduce the potassium level. Meanwhile, the recommended potassium level is 2000 milligrams per day. So we've already spoken about 2000 milligrams of sodium chloride, or at least 1500 milligrams of sodium chloride per day. Mild chronic kidney disease patients can move towards at least 4700 milligrams per day. Now, phosphorus, on the other hand, is also another crucial mineral that helps with bone and vessel health. Because this phosphorus is important, we also need to watch, because for chronic kidney disease patients, an accumulation of phosphorus and elevated phosphorus levels in the bloodstream will draw calcium away from the bones, leading to brittle bones and also cardiac complications. So aim for 800 to 1000 milligrams per day when it comes to phosphorus. High phosphorus meals that you need to look out for include dairy products, legumes, nuts, chocolate, and processed wheat. Instead, for low phosphorus meals like fresh fruits and vegetables like apples, berries, and grapes. If you notice, some meals here actually help across board in terms of your management for sodium chloride, your management for phosphorus, and your management for potassium. Apples and berries, for instance, help because they are low in potassium and also low in phosphorus. Most protein-rich meals also replete with phosphorus and potassium, although not all protein-rich meals do that. But for a CKD patient, chronic kidney disease patient undergoing dialysis, we always advise for that patient to stick to high protein diet. Lastly, egg whites are also not rich in phosphorus, but their yolks are. For calcium, on the other hand, they are very beneficial for robust bones, teeth, and nerve function. But in a chronic kidney disease patient, they induce an imbalance in bone metabolism. This can cause for calcium to now be increased in your blood vessels and also impact your heart function. So your healthcare provider must assess your blood calcium levels to know what can be recommended for you. But in general, recommended calcium levels should not pass 2000 milligrams per day. Now, for protein is very important for preserving your muscles and tissues. So it's a double-edged sword, because too much protein causes problems for your kidneys, but inadequate protein is also a disadvantage for you because it will lead to malnutrition. Now, in the initial stages of chronic kidney disease, aim for 0.6 to 0.8 grams of protein per kg of your body weight. But for an individual, for instance, if I give an example, an individual that is weighing 70 kilograms, This equates to about 42 to 56 grams per day of protein. Now, we've already spoken about how dialysis patients require a high protein diet. So due to this, they should look towards 1.2 grams per kg of their body weight as what is required in terms of protein consumption. Now, studies have shown that plant-based proteins like legumes and grains may be more beneficial for chronic kidney disease patients rather than animal proteins. Now, how do you ascertain or how do you show that, okay, I'm eating enough protein? I'm eating enough protein for my body weight. You assess the albumin levels. Aim for at least more than 4 grams per DL. This test is not the most diagnostic test that would show that you're eating enough protein. In terms of fluid intake and monitoring your nutrition status, fluid intake has to be very particular when it comes to chronic kidney disease patients. Certain individuals may need to restrict the fluids, especially if you have advanced CKD or heart failure. You have to restrict your fluid intake so as not to push into fluid overload. Meanwhile, others might need to increase their fluid consumption so they can prevent dehydration and kidney impairment. Consult your healthcare provider to ascertain the most optimal approach for you. Now, your nutritional status would be evaluated through your lab results, your dietary assessments, and also your alterations in weight. Patients with chronic kidney disease should avoid regular vitamins like vitamin A, vitamin E, vitamin K, and vitamin C, as if they amass in your bloodstream or increase in your bloodstream, they can cause some harm to your kidneys. So that concludes today's episode of nutrition and chronic kidney disease. Remember, a well-balanced diet is one of the most potent things that we need to have in terms of managing chronic kidney disease. Always be informative and transparent with your healthcare team and dietitian so that your dietary regimen align with your specific requirements. Thank you for tuning to another episode of the Seco Direct podcast. If you found this episode beneficial, please subscribe and share it with anyone who would find value in this information. Stay tuned for the forthcoming episode, and until then, safeguard your kidneys and uphold optimal health. I remain your host, Dr. Tiwa. Till next time, I bid you adieu.